Good afternoon. This is Dr. Alan Craig with Harmony Hearing Center. Thank you so much for giving me a few minutes of your time today. I wanted to talk a little bit just about hearing loss, specifically about untreated hearing loss. Now, there are some symptoms of hearing loss that has not been treated that are pretty easy to see and are relatively common. For example, people with untreated hearing loss often say, huh, or what very often. They have difficulty just hearing and understanding normal conversation, especially if there is background noise in the environment, or sometimes if that conversation happens to be on the television. So these people say huh or what, and sometimes that can even be funny because of the amount of times that they say it, or maybe the person with hearing loss hears something different than what was actually said to them, and maybe they answer a question that wasn't asked, or many of us have experienced a lot of those things. Unfortunately, untreated hearing loss can stop being funny pretty quickly because what begins to happen is the hearing loss begins to impact the person's ability to hear and understand things that are important or valuable. So, for example, an individual that can no longer clearly communicate with a spouse or a close family member. Instead of being funny, it quickly becomes frustrating and sometimes even embarrassing. When someone can no longer hear their pastor or their Sunday school teacher or their healthcare provider, it also begins to have a significant impact on quality of life. And unfortunately, the difficulties that people have when they have untreated hearing loss tend to get worse instead of getting better. So people start out saying, huh, or what, but at some point they stop doing that and they just accept that there are things that they're just not going to be able to hear. So if you have ever sat with a group of people, maybe a group of friends or family members, and you completely missed the punchline of the joke, you know what I'm talking about. And so this results in a significant, measurable decrease in how much the person with hearing loss enjoys certain places and activities and events. So, for example, going out to eat with family members or friends becomes an aggravation instead of an opportunity to catch up or enjoy one another. Going to church, honestly, begins to make a lot less sense to somebody when they can no longer hear and understand the sermon or the Bible lesson. And it is at this point that we go from frustration to people actually avoiding things like restaurants and ball games and worship services. And at least for me, it is at this point that the hearing loss is not funny at all. When an individual begins to stop doing things or stop being involved in things that normally they would enjoy doing, now I'm not okay with it anymore. And so the hearing loss is not only causing a quality of life issue, but what begins to happen is the individual with hearing loss begins to become isolated. And studies have shown very clearly that when a person begins to become isolated, whether it's because of hearing loss or some other issue, not only does it impact that person's overall health, but it actually has a negative impact on that person's longevity, how long they are likely to live. And so we continue to see this progression as the hearing loss goes untreated. So maybe the most concerning potential effect of hearing loss is one that I think a lot of you probably have heard of because I've had a lot of people in the office that have brought it up to me. For many, many years, we have had some data that suggested that there might be a connection between untreated hearing loss and cognitive decline or some form of dementia. There was a study that was published back in 2022 that is actually still being further evaluated, and the data is still being managed, that has shown definitively that yes, there is a direct connection between untreated hearing loss and mental decline in many, many people. And individuals who got hearing intervention, who treated their hearing loss, had a measurable slowing of cognitive decline in over half of the cases that were studied. Now, cognitive decline or different forms of dementia is something that has started causing a lot of fear for a lot of people. That can be because it seems to be becoming more prevalent. It just seems like there's more and more people that are having issues with it. Or maybe it's personal. Maybe it's somebody that you know or love that you've had personal experience with the effects of cognitive decline and dementia. And I think we're probably a very, very long way from actually fully understanding this issue, but we do know that untreated hearing loss is a significant risk factor. And that's actually good news, because if you or someone you know or love has untreated hearing loss and you or they are experiencing any of the different levels of impact of that hearing loss that we've discussed, the good news is that for the vast majority of people, hearing loss is treatable. And I can tell you from all of the research, as well as 27, almost 28 years of personal experience, that sooner is better. People that wait to treat their hearing loss until they just don't have any other option never get the same outcome. They never get the same quality or effect from treating their hearing loss as people that start early. Now, that's a lot of information, and it's information about lots of people when we study people in large groups. What about you or the person that you're thinking of right now that you know has an untreated hearing loss? The process starts with just a basic hearing consultation. That lets us get a better picture of exactly what a person's hearing needs are and what their hearing problems are, and it allows us to answer any questions that you or they might have about hearing loss, hearing aids, whatever the issue may be. If the amount of impact of the hearing loss seems to warrant it, we can also do a complete hearing aid evaluation, and that will give us specific information on how severe the problem is and the exact nature of the problem in terms of what is being affected by the hearing loss. And so, as we have seen, hopefully through this talk, hearing loss and its potential effects can be complex and progressive, but getting started on finding the right solution is as simple as making an appointment for a basic hearing aid consultation so that we can just visit and get more information about what your needs may be. You can contact us by phone at 870-268-1488, or you can reach us online at www.hearingaidsjonesboro.com. Now, if there are any questions that you have about hearing loss, untreated hearing loss, hearing aids, or any of the things that I've talked about today, don't hesitate to drop us an email if you would like. That's info@hearingaidsjonesboro.com. If you or somebody that you love has a hearing problem, we would love to be a part of the solution. Thanks again for having me in your home for a few minutes, and have a wonderful day. Bye.